Keeping dental instruments clean and sterilized is more important than you think because dental professionals are at frontline risk of infections due to the bacteria they are exposed to. Not only that, but dental instruments are expensive. So as a dental sterilizer, you have to make sure that you take great care of them when you sterilize them and make sure they last as long as possible. Sterilized instruments make it safer for not only as a sterilizer, but for the patients we see and the dental professionals that are using them because they are clean and are bacterial free. The truth is, sterilization is actually the backbone to the dental field. I say that because if there was no sterilization, who would be there or what would be there to prevent infections from the bacteria that stays on all those instruments that were used? I learned about the importance of dental sterilization through the dental field, plus I did extra research for the speech. So today I would like to tell you about the process of sterilization. Let's start off with the beginning of sterilization, which happens to be personal protective wear, also known as PPE. Goggles. We have to wear goggles to protect our eyes from any harsh chemicals, blood, and bacteria substances that could fly into our eyes when dealing with these things. If any of these instruments has bacteria on them that are contaminated with any kind of disease and they fly into your eye, there's a high chance that you might get that disease from that bacteria. Another thing dental sterilization technicians like to wear is gloves to protect their skin from harsh chemicals, blood, bacteria, and pointy instruments we deal with. You'd be surprised, but a lot of dental sterilization technicians poke themselves with the dental instruments that they have to sterilize. They are wearing gloves, but sometimes the gloves don't stop the pointiness from getting to their skin. If you were to get poked by a sharp instrument while on the job, they would immediately send you somewhere to get your blood work done to get tested for any diseases that might have contaminated you right then and there when you got poked. Lastly, we wear lab coats. We wear those because we like to prevent our clothes from getting blood, bacteria, and even chemical substances from getting on our clothes underneath and bringing them anywhere else but the laboratory that we're in. Make sure you remove your lab coat. That way you won't be spreading any bacteria that could be on that lab coat anywhere else besides the dental sterilization room. Now that we're wearing our personal protective wear, let's start the process. Sterilization has 4 steps, and make sure the dirty instruments stay on the dirty side and not on the clean side. Each sterilization room has a dirty and clean side. They are both labeled dirty and clean. First off, you would load the ultrasonic, also known as the shaker, with the dirty and used instruments. An ultrasonic is a device that is used to soak and shake the instruments. What that does is break up the contaminated surface of the instruments and clears it away. In other words, it cleans the instruments to a certain extent. The next step in the sterilization process is taking the instruments out of the ultrasonic and rinsing them and inspecting them. Be sure to rinse the instruments thoroughly to get any chemical substance off of it and any bacteria substances off of it. Sometimes the ultrasonic doesn't get all of the blood or the buildup that are on the instruments, so what you would do is take some cabbie spray or a cabbie wipe and just wipe it off the instrument. Now, if that doesn't come off, then take the dry wired brush that is provided and scrape it off until it's gone. Next up is wrapping large rectangular cassette kits and packaging loose instruments. To wrap the cassettes, you would use the blue fabric that is provided to wrap them, and it also gives you some sterilization tape that is clear, but when it's sterilized, it turns black and white. Make sure both the wrapped and packaged instruments are dated and initialed with your initials. The last step in the process is sterilizing the instruments in the autoclave, which is also known as the sterilizer. Load all of the wrapped and packaged instruments into the autoclave until it is full. Shut the autoclave door and then press the button that says pouches on it and then press start. Now you wait for about an hour to an hour and a half for the cycle to finish, and then unload the autoclave onto the clean side of the sterilization room. In conclusion, sterilization plays a very important role in the dentist field, and it is needed every single time after every use of every instrument. And it is crucial to sterilize all instruments even after one use, because that is to prevent any diseases or viruses from going around, like just bacteria from spreading, just to keep everyone safe. Thank you.